My name is Marva Wisdom, and I am honored to moderate these Finding the Balance during COVID-19 webinars. Let us start by taking a few moments to acknowledge the land on which we work, where we live, and where we play. Recognizing the continued and ongoing effects of colonialism in this area, Ontario and Canada. And as people living and working in Waterloo, Wellington, we would like to acknowledge and honor that Guelph is situated on the ancestral homelands of the Anishinaabe peoples, specifically the traditional territory of the Mississaugas of the Credit First Nation. We also acknowledge and honor that CMHA offices in Kitchener, Waterloo, Cambridge, and Fergus are situated on the Haldimand Tract. And the Haldimand Tract, this is the land promised by the Government of Canada to the Six Nations that includes 6 miles on each side of the river. And this is a traditional territory of the neutral Anishinaabe and Haudenosaunee peoples, which include the Seneca, Cayuga, Tuscarora, Onondaga, Oneida, and Mohawk First Nations. Today, our gathering places are home to many First Nations, Métis, and Inuit peoples. And with gratitude, we acknowledge that the settler population has been able to benefit from this beautiful land, including myself and my family. As citizens, we have a responsibility for the stewardship of this land, acknowledging the land and people. We are one, and we are only a small part of the process of decolonization, but that we must do. We must all do this, our part, in committing to truth and reconciliation. So welcome everyone to what started last June as a Bracelet of Hope awareness and fundraising with Tracy Curtis, its chair, Bracelet of Hope's chair. She sends her regrets tonight, so I'm standing in for Tracy. And now we have a monthly event. We thank Allison and Megan and team CMHA for the organizing and skillful behind the scenes work. We have a little bit of an internet glitch today, but we are committed to getting this all done, and I think everything should be fine. So I just wanted to let you know ahead of time, just in case anything happens. We're going to work to ensure that we provide you with an opportunity to answer your questions. And I am excited as the moderator for this monthly event. And so each month, Anne-Marie and Helen will be the two panelists answering your questions about the mental and physical implications of COVID-19 pandemic. And of course, Anne-Marie, as you know, is a primary care physician in Guelph, providing comfort and guidance to thousands during the pandemic. She's become a Facebook sensation with her daily posts of encouragement and sound scientific knowledge about COVID-19 and other health issues. Helen Fishburn is the Executive Director of the Canadian Mental Health Association of Waterloo, Wellington. She's a lifelong advocate for increased awareness of mental health issues, and she has dedicated her career to advancing the design of an improved mental health care system. And indeed, she's working on a number of projects to ensure that our community is inclusive when it comes to delivering mental health care. We are really delighted that Dr. Nicola Mercer, our Medical Officer of Health for Wellington Dufferin Guelph Public Health, has joined us not just tonight, but she's joined us several times past, the last 2 or 3 times actually. We're thrilled that she took time out of her very, very busy schedule to really have an opportunity to hear from you as she has been during this entire pandemic. We're happy to have all 3 here joining us as panelists to answer your questions. So let me quickly go over a couple of housekeeping rules so that you have some information. Tonight, you might be joining us either on Zoom, this webinar link via Facebook, or it could be a live broadcast. Well, Facebook live broadcast. We're ready to receive questions from either platform. So we're asking you to feel free to type your questions into the question and answer section of either Zoom or Facebook. We will try to get to every question tonight, but we might not, because sometimes there are a lot more questions than we have time, but we will work on answering them nonetheless after the webinar is over. We are recording this webinar and it will be posted on CMHA's Waterloo Wellington webpage and on Dr. Zajdlik's Facebook. So you will have access to this sometime within the next 48 to 72 hours. So not to worry, if you have friends who have missed this, you don't have to take notes. They'll be able to watch this. So let's get into our discussion tonight. And before we get started with your questions, we're going to ask Helen, Emery, and Nicola in that order for some opening remarks and their reflections on where we are and where we're going, and some high-level information as to what you might need to know as we undertake this discussion. Over to you, Helen. And I know, Helen, I'm going to ask Anne-Marie to start, and then Nicola until we get Helen back. Remember the little glitch that I mentioned that we're having tonight? That's one of those little glitches.
Helen is part of the glitch.
Yeah, Helen. But we are going to make it work tonight, so not to worry. So thanks, Anne-Marie.
So I think since our last webinar, which was first or second week of June, I think, there's been a lot happening in the world, not just around COVID, but the residential school discovering unmarked graves, which broke my heart. And I don't think I'm recovered from the shock of that or processed it well enough. It'll take time, but that has kind of toppled my equilibrium, along with now the collapse of the condos, the condo in Florida, fires running rampant across the country, evidence of climate change everywhere. So it's really tough to continue dealing with COVID when we see all of these other traumatic events around us. And so I'd like to recommend that people stay as much away from news they don't need as possible right now. You do need to stay focused on COVID because we need to understand what public health is recommending. And we also need to encourage everyone to get vaccinated. And on that note, new information suggests that for herd immunity, we need a 90% vaccination rate. Dr. Nicola Mercer, our fearless leader, has led us very close to that. I know we're close to 86% in Guelph, but it's really slowed. And so I want to put my heads together with this beautiful group of women to think about how we can encourage the vaccine hesitant to become vaccinated, and how most of all people can steer away from misinformation that causes us to be fearful about being vaccinated. So we're aiming for 90%, and I would like to see this community where we've evolved from, I know there's many communities joining us tonight, lead the way towards that 90% mark in Canada.
Well,
that's great. Thank you, Anne-Marie.
I'll just follow on with that to say that 90%, we can do it. I think 90% is, I believe that there was a politician who used to talk about stretch goals, but I don't think this is a stretch goal. I actually think this is a goal that we can achieve. So for the city of Guelph, that actually means 5,138 people. Well, there was a few people done today, so I don't know what the number is, but it's about 5,100 people or less. So is that a stretch goal, or is that really realistic to say we have far more than 5,000 people who are eligible and could have a dose? Yeah. And so for that, I would say, yay, Guelph, keep it up. And for others who are listening in the county or even further away, these are attainable. Lots of communities are in the 70s, fewer communities are in the low 80s. But we haven't yet seen a community hit 90% vaccinated. But I believe it's going to happen. Guelph might be the first one. But if you're listening from another community, go for it, because I would actually cheer you along if you got there ahead of us. And why is this so important? It's so important for our children going back to school. And I'm sure there's going to be lots of questions about that tonight as we look ahead. And as we go from what has been really pandemic, lockdown, hunker down, how do we look at this virus, how do we survive this virus, to how do we begin to recover, and how do we begin to renew, and how do we begin to go forward? So I'm anticipating that there's going to be questions on vaccination, questions on what people have said or things that you've heard, what's going to happen in the fall, and all really looking forward to hearing your questions and to trying to answer them today.
Thank you, Dr. Mercer. Thank you so much again for being here tonight. You have heard a lot about the World Health Organization and statements coming out from there. Do you mind us starting off with addressing that, and then we'll move into the questions afterwards?
Yeah, well, thanks very much for the opportunity to speak to that. I can remember when I heard on the news or somebody sent me a tweet with like just that sentence, and I was like, what? Like,
Yeah.
where's this coming from? Like, I follow all the literature, I read all the literature, and I'm like, what? So of course I had to go and read and investigate it. It turns out that it was a very small sentence that was taken out of context. So what this person was talking about is actually quite different than what has happened here in Ontario. So in this particular case, we're talking about, especially in more wealthy countries, people who are fully vaccinated. So for example, I'm fully vaccinated with 2 mRNA, deciding that, you know what, I think I want another vaccine. I just want to be sure, I want to really make sure that I'm protected from COVID. So I'm going to get a 3rd or a 4th vaccine, usually of a different family. So if I've had an mRNA, then I may be seeking out a different family. So one of the more the viral vector vaccines, and there's a number on the market other than J&J and AstraZeneca and the Sinovac Sinopharm. So that's what she was were talking about, was it is dangerous in a world where we still have limited vaccine supply for people who are wealthier from wealthy countries to go out and try and get more vaccine for yourself when you don't need it, you're fully vaccinated. And what it might do is disrupt the world balance. We have many countries, in fact, some very developed countries that are actually under vaccinated. If you look at Japan today, a very developed country, they don't have high enough vaccine rates in their country. And that is just Korea. There's other countries that I can think their vaccine rates aren't high enough. So for European countries, for Canadians, Americans to hog vaccine, it's a dangerous world path. And she did make that statement, and that sort of was what she was talking about, was getting that 3rd and 4th dose of vaccine, not mixing vaccines. So I really just want to clarify that. I think it's important for people to know that it was taken out of context.
Thank you, Nicola. And I'm just going to read one of the questions that came up about that, just in case there's something within this individual's question that you can even expand on, and then we go to the rest of the question. The Cheryl writes, the WHO has advised that mixing and matching vaccines is not safe and long-term effects are unknown. And then she says, how is that supposed to give us confidence? She says her daughter's now refusing to get her 2nd vaccination. She got the AstraZeneca the 1st round and was deathly ill for over a week. And she would like the Pfizer this time around, but now reads this. And she says, I don't think she'll ever be convinced to get the 2nd one after hearing this. And so she's frustrated with this whole thing and feels like we're just guinea pigs. So this part about feeling like we're all just guinea pigs, maybe that's the part that if you could address that for Cheryl, who is likely listening tonight.
Yeah, and I hope Cheryl is listening tonight. And I really hope your daughter's listening. And for your daughter who got the AstraZeneca, you know, I kudos to you for being one of the first to go and get a vaccine. And I would welcome the opportunity to give you your vaccine at one of our clinics. So if you want Pfizer, come right over. We'll get you your Pfizer, Cheryl's daughter, whatever your name is. Let me just, honestly, we mix vaccines all the time and nobody asks us. So if you go to your doctor's office and you're getting a hepatitis vaccine, for example, you get 2 doses or 3 doses, depends on which one you're getting. Most of the time, we try to keep you the same. But if it's in the same family, you'll get a different one, and nobody ever asks us. So the 2 mRNA vaccines are in the same family. They are very identical. They are biologically what we call biosimilar vaccines. They do the same thing. So I have complete confidence that that is that they are interchangeable. When it comes to AstraZeneca and mRNA, you actually are correct. They're 2 different vaccines. One's a viral vector and one is a mRNA vaccine. What we now know, though, is, and there are some studies that support this. There's a study out of Spain, and there is ongoing studies. In fact, there's a really big one that's been done in Canada, which we don't have the results of yet, but it is ongoing. Looking at, it's called the Mosaic one, the one in Canada, looking at mixing AstraZeneca and an mRNA. It is safe, it's effective. I really would encourage you, and for the most part, I mean, I had an mRNA. Yeah, I would have to say the next day, I kind of felt a little off. I wasn't really myself. Lasted probably 18 to 20 hours. It's not unusual after a vaccine to have a short period, but I would say that it's 50-50. 50% of the people have zero effects. They don't even know they had it. And 50% have some mild symptoms that go away quickly. So please don't let that discourage you from getting a dose.
Great, thank you so much. And Cheryl, we look forward to hearing from you. Just write back and let us know after hearing that, how you're feeling. And as Dr. Mercer has said, she's happy to, I think you said, talk to her daughter or even connect in some way. So just reach out. You could reach out to us via Facebook. We'll be happy to have a conversation with you. Not I, because I have no medical training background. I'm just moderating, but certainly between our group with Nicola and Marie, someone can have a chat with your daughter. And we're happy to have Helen here. Yay, Helen. Helen Fishburn, I introduced you earlier, Helen, so they all know who you are. And I know you didn't have a chance to provide some opening remarks and reflections as we get into the questions. Dr. Mercer just addressed the WHO question about safety of mixing vaccines and addressed it very thoroughly and certainly responded to one of the questions as well that was related to that. So if you could provide us with some opening remarks and reflections as related to mental health and how we can work through this.
Sure, and my apologies for the late arrival. Our network is actually, we've been having some troubles at the agency, and literally it went down just as we were going live. And so I'm practicing my personal resilience training this evening as I am literally adapting and adjusting as we go. Fortunately, our colleague Allison lives very close to our office, so we zoomed on over and yeah, literally. So anyway, apologize for that. Yeah, I think we're in a really interesting time right now in the pandemic. Obviously, we've been through a lot together in the last 12 months since we've been doing these webinars. I was kind of reflecting on the physical and mental health journey that we've been on. We've unpacked it all together on these webinars, but we're really at a kind of a hopeful and tangible moment in this pandemic, and really hopeful about what this post-pandemic will look like and the joy that it will bring back to our lives. But that's also a bit of a mixed blessing. There's lots of people still struggling with trusting and easing back into that. And we actually really see that in a very interesting way with the tension between vaccinated and unvaccinated people right now. And we're seeing it play out actually in a bit of a very sad dynamic in families, in work environments, in travel and sports teams. And there's a real escalating and growing tension that exists there that is actually causing a rift in families. And we're quite worried about that. So we're going to unpack some of that tonight. I know there's some questions about it, but I know post-pandemic, I think the focus will be away from our physical health and really more on some of the mental health recovery and working through the layers of this trauma and this experience that we've all had together. So tonight, I really look forward to answering some questions around that, along with my colleagues and this amazing team. So thanks for your patience and perseverance, and we'll carry on.
Oh, this is awesome. Thank you. It's great to have you back. We're so excited. And as you mentioned about perseverance and families, one of the things that Emery said earlier on in her opening remarks, she talked about trying to stay away from social media and and other places and spaces, if you can just surround yourself with some positive news, recognizing that there are things that are happening in this world that we need to be aware of, so that we can help to be a part of the solution. But sometimes overexposure to some of those happenings can make it really challenging for our mental health. So thank you for that. Susan has asked, now here comes, these are some of the, this is the way that the tenure of the questions change. She's heard that certain cruise lines, you know, a few months ago, we couldn't even be thinking about cruises now. So this is a positive. Shows and even cruise line shows and even countries are not admitting Canadians who have different vaccines for both their shots. Would it ever make sense to get a third shot of the same vaccine so that I can show at least 2 shots of the same? And maybe Nicola, you were talking earlier about WHO. Maybe you can respond to that one.
Oh, I was typing an answer. Can you just give me the punchline?
Is that an answer to that question?
So cruise lines.
Yes.
Yeah.
And 2 different vaccines. I think I'll just start, and then Nicola, you'll understand the question by my short answer. I think we're going to go on a country by country basis, and more and more countries will come on board with approving the vaccines that Canadians have received. If a country has not approved the vaccines we're using, it's very hard for them to say, we're going to let Canadians in who've had a vaccine that our national approval authority has not approved. But I think once more and more information is shared between countries, and countries look at the results of other companies, pharmaceutical companies that make vaccines they are not using, that the lines will open up. But in the meantime, until each country approves the vaccines Canadians use, there's going to be some restrictions put in place by people that run cruise lines or large hotels or airlines, for example.
And so perhaps the part that, thank you, Anne-Marie, Nicola can take is the part about the third vaccine is what this person is suggesting. So my colleague, one of my work partners, had got AstraZeneca, and I think the second shot might have been Pfizer. And he does a lot of work in the United States. And his concern is that he may not be allowed to go over to the States because they're not recognizing AstraZeneca. At least that's what I'm hearing. So this person is suggesting a third vaccine, maybe of the RMNA kind, to assist with this.
Yeah, these are great questions. And first of all, let's go back to the cruise line one. So cruise lines are in the business of making money. And so they want people to actually go on their cruises. And actually, I personally believe that these are going to be fairly easily resolved in terms of cruise lines who are business entities who want, really what they want is reassurance that people aren't going to bring COVID onto their cruise line. So the AstraZeneca problem for the US is I believe it is a short-lived problem, and now that the borders are beginning to open up, this is something that is going to be faced. It's going to be faced by many Canadians, and especially going from Canada into the US, because the US does not have AstraZeneca approved. Now, I'd also want to say, though, that Health Canada hasn't approved a few other vaccines in the world. So the 2 that Health Canada has not approved, which the World Health Organization has approved, is Sinovac and Sinopharm. So for many parts of Canada, if you enter with those particular vaccines, you're not considered vaccinated and do have to quarantine. So I just sort of want to point out that it's not just a Canadian going into the US with an AstraZeneca or an AstraZeneca mRNA mix. It's actually people coming into Canada with mixed dosing. So this is actually a global, worldwide sort of struggle as we all try to figure out what does a COVID passport, even though I know that's not a very Canadian thing to do, but this is where we are. Now, for you, for asking about, can I get that third dose? There is no mechanism right now for you to get that third dose, but please, it is on a lot of people's radar. I can tell you right now that Theresa Tam knows of the issue. Our CMOH, Dr. Kieran Moore, has spoke to her about it. So I know that this is an ongoing issue because you are not alone. I think if there was a dozen of you, it'd be a problem. But we're actually talking of hundreds of thousands of Canadians who've had the AstraZeneca. So many people have. So this is something that I believe over the next a month or two, we'll certainly hear more about it as the borders are opened.
Thank you, Nicola. Helen, Jennifer says, I'm finally feeling like there's hope, but I've forgotten how to enjoy life.
Yes.
What advice do you have for those of us who have and are still feeling numb from the pandemic?
It's a great question, and I think a lot of people are feeling that. It's almost like you're scared to be too hopeful, right? Because there's so many ups and downs. And, you know, there's been other moments before where we've felt a lot of hope and things returned back. And then, of course, we were crushed with another wave again. So it's hard for people to let their guard down and to actually trust the vaccines and trust that we're going to be on a good path moving forward in a solid way. But science does not lie, and we're continuing to see as the vaccinations go up and the illness goes down. That is the truth. That's the reality. And that's really reassuring. We aren't quite there yet, but it is really reassuring in terms of where we're going. So what I would really say is to do everything you can to be mindful, to be present, to be aware of what those thoughts and feelings are. We've talked before about, you know, not wanting to go and jump whole hog into one end of the continuum where you're completely ignoring all the restrictions and all the public health guidelines and being reckless. That's not a good approach. But we also don't want people to be isolated and alienated in their homes when they're doubly vaccinated, and they don't need to be. So somewhere in the middle is probably the best opportunity or option for all of us right now. And I think continuing to manage your feelings, manage your anxiety, to understand that it's there, to be sensitive to other feelings as well. There might be people that are really joyful and excited about going out for dinner, going out to a movie, and other people don't feel that way, right? So just trying to be mindful and continue to walk through this journey, talking to people, understanding the science, following the public health guidelines. It's one of those one day at a time and one step in front of the other kind of approach. If you're really feeling anxious though, and you're not prepared to venture out into the world, that's a sign that you need some support to be able to do that. So whether it's an online CBT program, talking with your family doctor or people that you trust about how to make those steps, that's really important. We want people to be able to make some progress. Oh, Marv, I think.
I know some folks are planning trips. I know I received a message from a very dear friend who's finally getting married after waiting for 2 years during COVID, and it is overseas. And I am so scared. I have bought my ticket, but I am really quite concerned and hopeful in some ways. I'm hopeful, the trend and where it's going. So I believe it's going to hold, and that's why I bought my ticket. But it doesn't mean that in the pit of my stomach that I don't still have a little bit of apprehension.
Here's the
So
other
I think,
and it's a really good point. When you go to that wedding, enjoy it.
yes.
Allow yourself to enjoy it, right? Breathe
Yes.
in, take it in. We've been waiting a long time for this, so don't hold back from experiencing that joy as well.
Yes, thank you. Looking forward to it. Looking forward to dancing with people again. One or two. Another question for us. Have there been studies on the effects of COVID-19 vaccines and the ability to get pregnant? I know we've asked the question in the past about while you're pregnant and the impact of the vaccine, and this person is asking about the ability to get pregnant. Maybe Anne-Marie, if you're not in the midst of typing away a response.
No, I think Nicola is sharing the typing with me, and it's
This is so good.
I get a crook in my neck when I try to answer. So there, at this point, is no effect and no biological way that the vaccines could affect your fertility. And once you are pregnant, the vaccines are safe, and it is you're at greater risk once you're pregnant if you get COVID than if you get the vaccine.
Okay, that's great. Thank you. Is the vaccine less effective in people that have an autoimmune disease, or is it about the same?
Shall I answer that one?
Yes, please.
I'll let Anne-Marie type out another answer. We'll just tag team it. So yes, the answer is that they are less effective, but this is actually quite normal. So for people who do have immune suppression, and I mean people who are very immune suppressed, so people who've had solid organ transplants, people who are undergoing chemotherapy. I'm not talking about somebody who has a bit of rheumatic or some kind of arthritic disease and maybe on a lesser agent, not a biologic, but a lesser agent. I'm talking about severely immunosuppressed people, and they know who they are. The vaccines, any vaccine, does not work well. So it is not surprising that the COVID vaccines, although they do appear to work much better than some of the other vaccines that we have used, but it is possible for severely immunosuppressed people, like they have in other countries, that they may need a third dose as we try and get their bodies to respond to the vaccine. But that doesn't apply to the vast majority of us, thankfully.
Great, thank you. And Chris is concerned, Helen, about the massive change it will be for kids going back to school and what can be done to help them prepare for September so that it isn't as much of a shock. Lots in the news, I think, today and yesterday about going back to school, the new normal for whether university kids, elementary or high school. And a lot of parents, I'm sure, are anxious and excited at the same time. Can you comment on that and how to prepare, Helen?
I will, and I think the key word in that question, Marv, is prepare, right? So it's July now. September is still a ways away. I think the most important way you can prepare your family is to get everyone fully vaccinated. So they're going back into the school system fully protected. And again, if parents are concerned about that, about their child's impacts of a vaccination on their child or themselves, certainly it's really important to work through those fears and make sure you're following facts and science, not basing it on fears and information that is not reliable or based in science, right? So working through some of those things with your kids is very important. And then understanding, of course, we'll find out more information, but understanding what the limitations are at school. So your child is going back into their classroom. So what are the rules? What are the new rules which will be there in September? What are the rules around physical distancing, around masking, around hand washing, around the norms, right? They have changed as we've gone through this pandemic. They will change again. And eventually, as we all know, as we reach herd immunity, there will be a much easier way for all of us to exist, including kids in the classroom. But the more we can prepare our kids, no matter what age they are, for what that classroom looks like, how they can be safe, how they can be prepared emotionally. And then, as I mentioned earlier, to really encourage them to be able to experience the joy of returning back to their classroom, seeing their friends, interacting. All of that is really important too. We want to manage their anxiety and get them well prepared, but we also want them to be able to experience the joy and the fun of just being a child. That is important as well. Teachers and school boards will have a big role to play in helping everyone prepare for the fall, and we'll certainly take their lead, but there's a lot that we can do to get our kids emotionally ready.
Mm-hmm. And I think one of the other bits with kids being out of school, you're going into a school environment. Some might be going into a new school, a new grade, new teacher. Things are going to look a lot different for them, right? And so it does take a village in this case. It always takes a village to raise a child, but certainly getting prepared to go back to school, the teachers and the school environment, and of course family and friends in our entire community. It's so important how we support this new normal that is going to happen in September.
And we know that kids need to be back in school, right? That's for
yes.
their mental health and their wellness, is to be back in school where they belong. So we want to celebrate that. We want to support that. And we want to do everything we can in our power to keep the environment safe and to keep kids and teachers safe.
Mm-hmm. No, that's great. Thank you for that. I am going to, there are 3 questions and they're all related and focus very much around vaccine hesitancy and family. So I'm going to ask Emery and Dr. Mercer. So both Emery and Nicola just sort of riff off each other. I'm going to read the three questions with the person's name that's attached, so that you have it, and so that they can hear, if they're listening, their questions being answered. So the first one is from Lisa. So I'm going to read all three first. And she says, we have a 6-week-old baby new to the family, and right now only grandparents can hold him with masks. When would it be safe for the rest of the family to hold him? Aunts and uncles have been double vaccinated, but there are 2 school-age cousins who obviously haven't been vaccinated yet. And then Ina writes, my husband and I are fully vaccinated, but have family members who refuse to be vaccinated. Do we refuse their visits to our home or insist on masks and staying outside? I'm good with either, as it angers us that they refuse to comply. And then the third question from Dorothy, can fully vaccinated people transmit COVID to unvaccinated people? So those three are all related. I'll start with you, Nicola, and then to Emery.
Yeah, well, I'm glad I don't know any of you three people, because I think maybe I might get between a family or cause a rift, but let me go and sort of see if I can answer these questions for you. The first thing that I really want to say is that when you are vaccinated, fully vaccinated, you are protecting yourself first. Okay, so that's really important to know. We are protecting ourselves by being fully vaccinated. We are also, when we're fully vaccinating, protecting others. There are studies, they looked at healthcare workers, because even though you're fully vaccinated, there's a very, very tiny risk of getting COVID. And I mean, it's small, it's 0.02%, very, very small. So even though I'm fully vaccinated, there's a very small risk I could get COVID. Most people, in fact, the vast overwhelming majority of people who are in that boat have no symptoms or minor symptoms. And based on the studies of the families that we see of the healthcare workers, it appears that we're also much less likely to give it to other people. Either we don't have a very high viral load, or we're not maybe as sick as long, so we don't shed it to others. So that should give everybody comfort in saying fully vaccinated people are protecting themselves and protecting others. So for you, the family who says, what to do with my unvaccinated, brother or sister-in-law, I have family members, I would say, have them over in your backyard, enjoy the family, remember you are safe. So, keep your distance, do all the, be reasonable, you can be outside. It's a safe environment. Please don't cause a permanent family rift. Maybe by your behavior and knowing that you guys are safe, maybe you'll be able to convince them. I do believe that the vast majority of people who are not vaccinated is because they have some fear of something, right? They believe something that is erroneous. And I think over time, as many people realize, first of all, that those of us who've been vaccinated, we didn't grow a second head, and we're all healthy. And as we go through, I think you're going to see that more and more people will find it very inconvenient to be vaccinated. And I know this touches a nerve with a lot of people, but COVID is going to become a disease of the unvaccinated. We are seeing that now. All of the cases we get locally, we always find, are they vaccinated? Some are partially vaccinated because they're in the middle. They've had their first dose and they haven't had a chance to get their second dose. But most of our cases are unvaccinated, and often it's a whole family of unvaccinated people. So I think for, visiting with your family members, it's a little bit different with the baby. So let's just talk about the baby. And I think Anne-Marie would agree with me. Newborns, their immune system's not fully developed yet. It's in the process. They haven't had the exposure that we've all had. And I know we all want to protect the newborns. So I assume from the question that you're saying is that everybody's fully vaccinated. They want to see the baby. Well, you can show them the baby outdoors is safer than indoors. Make sure people wear masks when they're around the baby. And when it comes to the unvaccinated children, maybe this isn't quite the time to see the baby too close and personal. So try and keep them outside, 6 feet from your baby. They can look at the baby as opposed to just, as children do, they want to touch and hold them. Their time will come. But let's try and keep families together over this. We don't want to create permanent rifts, and we want to model that vaccination is a safe and healthy alternative. No, you're on mute, Martha.
Of course, I am on mute. I'm going to add a fourth question to that before Anne-Marie jumps in. And that is, do you think the coaches who are coaching multiple groups of kids should be vaccinated? They're not masked or maintaining distance. And Deb is asking that question. So adding to what Nicola has said, Anne-Marie, over to you.
Okay, I'm going to jump out about being vaccinated or not being vaccinated. This is also going to sort itself out in the next little while, along with countries having a greater understanding of their vaccines and approving vaccines that are unknown in one country in that country. So for example, vaccines that we don't know from other countries, we will eventually approve them once we have time to look at the research. I think once we realize what Nicola said, and that is that COVID, which is going to be with us for a long time, but will be an illness of the unvaccinated. So people who have received a vaccine will get cold symptoms and they'll call their family doctor who will give them advice as to what to do. And because more evidence is going to show us that they're unlikely to transmit, I think the amount of time they need to quarantine is going to change as well. I also think that we're going to have to put some firm rules in place about who is vaccinated if they're interacting with the public. Right now, those rules aren't in place. I think it's unfair to individual organizations and healthcare organizations, sports teams, cinemas, restaurants to have to make their own decision about whether or not to allow admittance of individuals that are not vaccinated. I personally feel that coaches should definitely be vaccinated. You cannot guarantee that you're going to stay 6 feet away from the kids. And in fact, I don't think you can coach very well if you stay 6 feet away. It's a very unpredictable, sports teams and events are very unpredictable in terms of everyone's activity and where they are on the field. So personally, I think that they should be vaccinated. I think healthcare workers should be vaccinated if they're interacting with the public and if they're interacting with at-risk populations. And I really hope that our governments step up to allow public health, or they themselves give us directions as to who needs to be vaccinated or not. We're very Canadian. I don't think we want to offend, but it's going to cause a lot of difficulties, concern, and concern among individuals who have to interact with the unvaccinated if we don't put some steady rules in place. And Marv, I don't think that answered a question, but personally, I think they should be vaccinated. I don't think there are rules around them yet. Is there a part of the several questions that we have not answered yet?
The one part where having to do with the coaches who are coaching multiple groups of kids and not wearing masks or socially distance, and an opinion as to whether they should be vaccinated as well.
Until our kids under 12 all receive 2 vaccines, that's not safe. And so kids who've received a vaccine, it's safer, but I would really want, if I had kids with coaches, I'd want those coaches to be fully vaccinated.
That's great. That's good information to put out there.
I could
Thank
just
you.
in here, Marva, just in terms of the mental health part of this, and we're seeing a real rift between families, coaches and teams, workspaces where there is this great divide starting between the vaccinated and unvaccinated. And what I would really encourage people, and certainly Nicola spoke well to this as well, is we don't want to get into the blame and shame game. We don't want to start alienating and isolating people because right now they're too scared to get vaccinated. I'm really hoping, along with everyone else, that people will start to trust and eventually get vaccinated. But certainly creating that conflict, and it actually does more damage than good. We've seen families being ripped apart by this, and that one family member that is not vaccinated then becomes isolated and alienated from the family. They actually move into quite a place of risk. And when you think about terrorist organizations, and this is probably going to sound like a dramatic example, but this is how terrorist organizations actually recruit people, right? They find people that are in a dark spot, that are disconnected from their families and their workplace. They bombard them with false information, and then we lose those people, right? There's a break that happens. It's a similar dynamic that we're worried about here. Obviously, it's not quite the same as a terrorist recruitment, but it's the same kind of dynamic, and we really are quite worried about that person that's alienated. So if I could just say 3 things. One is don't give up on the person. One conversation is not going to do it. It's going to be a series of supportive and informational conversations over time. The second is a couple of people supporting that person is really helpful. Find out who trusts that person and have them talk to them, again, from a very supportive, non-judgmental place. And the third thing is really not to alienate that person, because the last thing we want is to dive them deeper into that darkness where they're really at risk. So if people can think about that as they're having these really difficult conversations, but ultimately we all want the same thing, but sometimes it's just taking people a bit longer to get there.
And
Can I converse with Helen and Nicola for a minute? Sometimes the conversations are interesting too.
yes.
I've seen families of people who are marginalized because they are vaccinated. So I've actually snuck patients into my office and vaccinated them. And they understand that in my office, it's all confidential. No one will know that they've been vaccinated, but they're so terrified of family members knowing they received the vaccine. So it goes both ways.
Really
You're on
good.
the margins. That's where you're going to find extreme thoughts and extreme emotions at the same time. So I agree with you. Remain supportive. Nicola, the question about whether or not there will be vaccine passports at many levels of society, do you think it's a good idea? Do you think that once we're at 90%, it's safe to not have those vaccines and not have rules put into place because there's so few people that are not vaccinated and will not likely transmit to, in particular, patients or children who are vaccinated? So this is after we've been able to vaccinate everyone from 6 months up.
Yeah, I'm not sure we'll quite get there, Anne-Marie, because it's kind of like the common cold. We all think about this. The common cold is really hard to cure. We all know we struggle with it over the course of our lives. We have it many times. We don't know how long the vaccines are going to work. They appear pretty good right now, so I'm not thinking that they're going to stop working anytime soon. But in the longer, bigger picture, we don't know how long they're going to work, and we don't know because there are going to be countries in this world that are never going to have much vaccine. Some very poor, under-resourced countries are going to have very, very low rates of vaccination. And those countries are going to become the places where variants are going to emerge, and then they will come to other countries in the world. So this is probably something the same as influenza comes around every year, and it's different every year. We all recognize that we have to have a flu shot. Most of us get it every year. But those are the kinds of things that I think we might be seeing, is that might have to think about a COVID shot in the future along with our flu shot. Who knows, maybe they'll be able to put them together in the same vaccine. I'm not sure about that, but I would suggest that I'm not sure that it will ever get to that place where we're all good and we don't have to think about this.
Yeah.
So does that answer it?
Yes, it does. Thank you. Marva, you're on
But
mute.
everybody, I want to get myself off mute before someone says I'm on mute. I'm trying to be so good and just so quiet, right? Because I'm writing things down and taking notes, and you can hear my pen going. And so I put myself on mute, and I say, I have to remember to get myself off mute before I start talking.
We don't mind if there's extra noise. Stay unmuted.
Okay. I just don't want to disrupt you with my ruffling. When Helen spoke about isolation, I think about individuals who might have a tendency to be more hesitant about becoming vaccinated. And they're very likely the people within families who are that way about most things anyway. And so they are the unique person, that uncle that you really love so much, but very opinionated, but he's still there at Thanksgiving dinner, and the one that you want to check on because you haven't heard from him in a few weeks and you don't know what he's up to. And so just to make that point, it's really unfortunate that all of us can think of family members that are, those folks who go off in the corner and do their own thing and don't claim that they're really independent and don't march to the beat of anybody's drum, and nobody's going to tell them what to do. And they mean well, and we love them to bits, and they bring such richness to our lives, but it gets complex and very complicated. And they're the ones that have always been vulnerable and have always been, we might say, difficult or challenging or different, and they continue to be. but you know, killing them with kindness, well, loving them, not killing them, but loving them with kindness and keeping the lines of communication open is so important. You can tell, like, all of us can think of one or two people. And so somewhere in between, the messages certainly from Anne-Marie, Nicola, and Helen, we'll find a way to reach some of those people, and we won't reach everyone, but we reach as many as possible. I have another question. Someone who's heading over to Nova Scotia and has been looking forward to this vacation to see their daughter that they haven't seen since 2019 and can't wait to give them a big hug. They're fully vaccinated. They're feeling really anxious, and any travel tips during these strange COVID days to put mind at ease as traveling down the road. It's nice that they're driving. That'll be a great trip.
Well, maybe I'll just jump in from a mental health perspective, and then there might be the kind of physical preparation. So I would say be prepared. So wherever you're going, so in this case, Nova Scotia, research where are they at in the pandemic? What does it look like in Nova Scotia? What are their rules? What are their norms? So you know what you're walking into. In some cases, that might be really good news. The community is doing really well. If you're traveling to Florida right now, probably not good news, right? So know where you're going and know what those norms are. Be prepared to bring some antiseptic wipes and, of course, all the things that you can do to take care of yourself when you happen to stop at hotels or to fill up your car with gas or things like that. Definitely, it's a good idea to clean the hotel room, the high touch points, right? So doorknobs, light switch, things like that. But we don't want people to obsess either, right? There's a reasonable amount of cleanliness just to keep a general sense of protection and comfort without going to that real OCD type of cleaning where it is causing you so much worry and anxiety and stress. Don't go to that extreme, but definitely, you know, be prepared, be reasonable, be common sense approach about it as well. And I would say, you know, stay vigilant in your trip. Keep mindful of the public health guidelines. Again, don't be totally reckless, but also allow yourself to enjoy. I think this is the balance that we're all going to have to try to find as we go, whether you're staying home or whether you're traveling. But certainly if you're traveling, having some of that vigilance is really, really important. Nicola, I don't know if you want to add anything to that.
Well, the only thing I was going to add, and it's not really a non-medical thing, but often when you visit other places in Canada, you have to remember that people may not see you as a friend, because in a pandemic times, sometimes people see you as bringing the COVID virus to them. So we've seen that in other times. You know, when we opened up, please don't let the Waterloo people come to our area. You know, we're open and they're not, because you know people don't want you to bring the virus. So you might want to just sort of open with, be respectful of others, and you know, in terms of, and if you are hopefully doubly vaccinated and you're going into the community, make sure that you respect them, that you wear your mask, keep your distance, and if you have an opportunity to say, yes, I'm vaccinated, I'm safe, and I'm here to just enjoy safely in your community. But I do think that that we as Canadians, I think it's great that you're traveling within Canada, and you can do so carefully and respectfully for the places that you're going.
I make a
Thank you,
comment
Nicola.
just on the heels of both Helen and Nicola. Remember that our public health measures keep us safe. And so if you're heading into an area where you're not sure if you're safe, you're double vaccinated, but you don't really know, put that mask back on and keep 6 feet away from other people. And if we can all be vigilant wherever we are to the fact that there may be unvaccinated people around you, or that public health restrictions may vary from place to place. I myself am going, I'm double vaccinated, vaccinated. On the weekend, for example, we followed guidelines and met with a group of people outside. I still kept my distance just because the variants of concern, I don't know, they transmit very easily. Outside, you're probably perfectly fine. I'm a little bit obsessed because I'm a doctor and I've seen sick people with COVID. But I think if you're worried, just pull back and follow those original measures that we know about now for over a year. 6 feet apart, put a mask on if you're concerned, hand washing when you can. This is much more an airborne type virus than a virus that lingers on surfaces. So being really strict about scrubbing down surfaces is not something that we need to be as concerned about now as we thought we had to be in March of 2020.
Thanks, Anne-Marie. Another question, Ludi has said that the UK has decided not to vaccinate children under the age of 18, stating that the risk from COVID is less than the risk from the vaccine for this age group. And the person says, a news story today says that 1 in 25 children hospitalized with COVID develop neurological conditions. They're very confused. Can you help with sorting out the latest information for children and vaccines?
Okay, I guess I'll take this one and first, and then Anne-Marie, you can jump in if I miss anything. I think we have to remember that, first of all, that the rollout of vaccines, it's being guided by the science, but there's also a political element to all countries' vaccine rollouts. And the UK is a very large country. We don't think of it as having a heavily populated country, but it's a much bigger country than Canada is. And they actually had a really tough time getting their vaccine out fast enough. So I think one of the reasons to not vaccinate under 18 was really a desire to try and get the vaccine out to those who are most at risk first, which is those who are over the age of 18. So I think that that is important. And it is true that it's the risk of what happens to you does increase as you get older. So most children, and I say most, under 18 and under, get mild symptoms or are asymptomatic, but not all. I mean, we absolutely do know that there have been COVID deaths in children, but they are much rarer than in adults. I want to just emphasize that. And so most children do quite fine. So if you had to choose who to, vaccinate, you're obviously going to vaccinate those. If you have a limited vaccine supply, you want to give it to those who are most at risk. And we did that in Canada and Ontario. To remember back in January, February, we had almost no vaccine. And who were we putting at the front of the queue? We had those in long-term care and the people who worked around them. And then when we had a little bit more, everybody was fighting to get to the front of the line, and we had to put those most at risk, so our hospital workers and those who are most at risk. So we did the same thing, and the UK, I think, did the same thing as well with their vaccine rollout. Most countries, US, Israel, most European countries are vaccinating 12 and up. And for those of you who have children who are below the age of 12, there will be studies that will be reviewed, and there will be guidance on this coming out this fall. I know it feels like forever. I know we all wish that it would have come out during the summer, because for those of you who have children, in that 5 to 11 age group that are in school, I'm sure you're thinking about this. It is my opinion that we will not have a vaccine for this age group. I don't think it's coming before Thanksgiving, and probably more likely November or sort of later. So we do have a ways to go yet, but there will eventually be a vaccine for children. Mark my word, there absolutely will be, and it will be most likely, as I think it was Anne-Marie said, in 6 months on up. That will be what will likely be the age range for vaccination against COVID.
There seem to be a lot of several questions around, your children under 12 not being vaccinated and you being fully vaccinated, and how to really be a family in that in that normal family way with your children unvaccinated.
Well, I just want to remind people, though, that if you are fully vaccinated as a parent, and I encourage you to be fully vaccinated, because what we saw time and time again throughout the winter months was that parents would get COVID out in their workplace predominantly and would bring it home to the family, and then those children would take it to school. So I really want to encourage you, protect your children from COVID by yourselves getting vaccinated. That's really important. You're right, we can't vaccinate the children that are under 12 right now. But if you are fully vaccinated, you are not going to get sick from COVID, and you are very unlikely to actually give this this virus to your children. So you can protect them that way. So although I do know that that it feels weird and it feels scary, enjoy your children. Do things with your children. We're in this really weird scenario right now, but your children will go to school with other children and families. And so let's just encourage all your friends, encourage the lowest age group for vaccination right now is 18 to 29. So you have teenagers or brothers or sisters who are in that age group, get them vaccinated. That's going to keep our community safer, encourage them.
And on the heels of that, I think parents are not only concerned about their children getting COVID or they themselves passing COVID onto their unvaccinated children. I think parents are concerned when they're going to a wedding, for example, and all the children are invited as well. I have a niece who attended a wedding, a family wedding a couple of weeks ago. She has 4 young children, none of them vaccinated. And it was, I can imagine how much anxiety was provoked. But remember, if you bring your kids to an outdoor event, an outdoor family event, and they're not vaccinated, outdoor events are much safer than indoor events. And you probably should assist your children in maintaining social distance from individuals who are not vaccinated. We are maybe 4 months away from having a vaccine that's available to children from 6 months and up. It's only 4 months or so of protecting your children using masking and distancing in a setting where you don't know if other people in the group are vaccinated or not.
Thank you, Anne-Marie. It's hard to believe that an hour has flown by so quickly. And so what I'm going to do is ask all of you for some closing remarks as we wrap up. I know that we have a few more questions left, but a number of the questions are related, which is great. So my hope is that most of you on the line have had some part of your question responded to, if not all of your questions. But to go in your opening remarks, can I ask all 3 of you to comment on Sarah's first part of Sarah's question, which is, what are your thoughts on the predicted 4th wave and Canada, as you share hopefulness and your closing remarks? And I'm going to start with Helen.
Okay.
Lucky you, Helen.
Well, I'm certainly very hopeful that we won't have a 4th wave. The higher those vaccination rates go locally and certainly across Ontario and Canada, the better it is. And so that's my hope. We also know that there are variants of concern which are insidious and which are preying on people, certainly that are unvaccinated. And that continues to be a concern. And we've seen that definitely. I'm also concerned just about this chasm, as we've talked about, between vaccinated and unvaccinated folks, and the tension and conflict that creates. And that can be a bit of a mental health pandemic in itself, in terms of damage being done. I read a really interesting article this week that compared the non-smoking campaigns to what's happening right now with vaccination campaigns. And what we learned about the non-smoking campaigns was almost nothing worked for smokers. They put labels on cigarette packages. They showed what cancer looked like. They sued tobacco companies and put them in court. Nothing worked to deter people from smoking except for one thing. And that was to really demonstrate the destruction and damage caused by secondhand smoke. So secondhand smoke to your kids, secondhand smoke to your spouse, to those people around you. That had a really lasting impact on people choosing not to smoke. I think about that analogy and an example, how we can use that with people that are scared to get the vaccine. And we can talk to them in a very sympathetic, compassionate, and caring way about needing to protect the people that they love, their grandparents, their kids, their close friends and family. And if we can take that approach with them, we might get some traction, but again, from a place of care and support. So those are the things that are definitely on my radar. There's a whole bunch of unpacking to do as it relates to the layers of trauma from this pandemic. And we need to do that over time and be aware, be present, work through those feelings that you have and thoughts that you have, especially as you venture out into the new world post-pandemic. But that's something that everybody needs to monitor and think about, and lots of people can reach out and get help for that as well.
Thank you, Helen. Thank you. Great advice. Great advice. And I'm going to throw another a bit of a wrench into Emery and Nicola's closing remarks as well. Could you comment also on the Delta variant and anything that's the latest so that our audience can hear that?
Who's going first?
Emery, we'll go with
Okay.
Emery and then Nicola.
Okay.
The best for last. Okay, fourth wave in the fall. I think realistically, there will be an increase in cases in the fall. Will we call it a wave? I'm not sure. Will it be as big as what we've experienced up until now with wave 1, 2, and 3? No, definitely not. We will probably see an increase in cases, but we're so close to being 80 or 90% vaccinated across the country that what matters in those cases is how ill people are who have COVID-19. So you may see an increase in cases. What I would like to see when we start announcing daily cases and they start to increase in the fall, which I think they will as we move inside, who is sick and who's not. Not an actual name of a person, but how many people require hospitalization. And eventually we'll have to live with this virus and know that there may be 100 or 200 cases a day during cold and flu season when we move inside, but we don't need to report those because those people don't require treatment or hospitalization. So realistically, there's going to be an increase in the fall, but it's not going to be one that overwhelms our healthcare system or lays a huge illness burden on the population.
I'm going to agree with Anne-Marie that I think it's inevitable that we're not going to see an increase in cases. I think most people feel that if you think of COVID a lot like flu, it is really a winter disease. It's a disease of people. And when do we see flu? We see flu when we go back indoors and we start to see the cases go up, especially after Thanksgiving and as we get closer to Christmas. So that we do know. We also know that we have a significant part of our population, our children, 11 and under, who aren't vaccinated, and we have adults 18 and over who are not vaccinated as well too, or 12 and over who are not vaccinated. And those are the people who are at risk. So for those who think that, okay, good, I haven't been vaccinated and I'm not going to get it, just think again. I think that you're going to find that for people who choose to not be vaccinated, it's really just a matter of time to when you get this disease. It's kind of like for people who've avoided flu. You can avoid flu some years, but some years you're going to get it. It's really hard to avoid certain viruses, especially when they're transmitted person to person and they're aerosolized. So all it takes is a cough in an elevator or a conversation with a coworker with a coffee, for a little bit too long. And so it doesn't take much to get this particular Delta variant. It is very transmissible. Any new ones that come along and circulate are much more likely to be more transmissible even than Delta. And so that's what makes them spread, is they have to be more transmissible. So do I think there's going to be increased cases? Yes, I do. Do I think it's going to cause us to go into lockdown and to have all the bad things that happen? No, I do not. I really, and for those of you who are listening, if you want to stay working, you want to keep your family healthy, we do all the right things normally. We eat well, we exercise. This is the one thing that we can do that I can tell you with absolute certainty will protect and keep your family safe, is to get this shot. Get 2 doses of this. It will protect your family and those that you love from you giving it to them and from you getting it and getting ill. So you're protecting yourself too. So for all the moms and dads out there, you want to make sure that your children have a mom or dad. So please go out and get this shot for them.
So all 3 of you are in agreement that likely no 4th wave. However, with the flu season and regular indoor winter, we likely might see a spike but we need to do what we can do now. Any just final, the Delta variant is a top of mind for a lot of people. Any comments, certainly even with Helen, what you might be hearing from CMHA from the mental health perspective, and then we'll just do closing remarks and wrap up. I think we're allowing ourselves till about 8:15. Yeah.
Can I interrupt for a second, Marva?
Absolutely.
I think the press will call it a fourth wave because it just sounds more dramatic if they call it a fourth wave. So when I say there will be a spike in cases, I wouldn't be surprised if it's called a fourth wave, but it will be so much safer, less dangerous than what we called wave 1, 2, and 3.
Great, thank you. And Delta? Are we seeing much of it here, Dr. Mercer?
Oh, sorry, I was answering somebody about a question. Are we seeing much Delta here? Yes, actually, almost all our cases are Delta. We are, unfortunately, have the distinction of being one of 4 health unit areas that have a fairly high incidence of Delta. So what we're seeing in Waterloo could happen here. I don't think it's going to for Guelph, though, because I've been holding my breath ever since Waterloo had spiking cases and was seeing a lot of Delta, because we're close cousins on this one, and a lot of families go back and forth. But as long as we can continue with our vaccination rates, I really believe that 90% vaccinated for Guelph is doable. I would love to see that happen. I believe for those of you who are listening who are outside Guelph, that we will and should see rates in the 80% range. And slowly, as people begin to realize that, you know what, we all get tetanus shots and nobody fights and talks and worries about getting a tetanus shot. I do a travel clinic and I offer some very odd and weird and expensive vaccines for people who travel, which have side effects and are much worse than these COVID shots. And nobody thinks twice about taking some of those vaccines to go to some countries to protect them. So please consider, if you're not vaccinated, just consider again that the option of being vaccinated. But I do think that over time we will see a change, as we often do, to vaccines when people realize that these vaccines protect them and it gives us back our lives, gives us back that new normal.
I'm going to remember one of the things that you said. I'm going to remember most of what you said, but one of the things that you talked about was transmission in elevators. And I'm thinking, hey, more people are going to be taking the stairs. We're going to be fitter and choose the stairs when we go back to work rather than the elevators. And on that note, Helen, did you have any comments as to the Delta variant, or you're okay?
Well, it's, I think Nicola and Anne-Marie both spoken so well to it. What I would say is there's mental health protection that goes along with it, right? So obviously we want everyone to get fully vaccinated because that provides the most amount of physical protection. But don't underestimate the fear that comes along with the Delta variant and just COVID-19 in general. It's been a year of fear, a year of losses, right? It's been really hard for folks. So the best way to protect our mental health and to continue to build our resilience is to continue to do the things that feed your soul, feed your heart, feed your mind, talk to people, get out there and exercise, eat well, sleep well, and really seek supports if you are not feeling well and balanced, if you're not sleeping well, if you're really anxious, if you're not wanting to go out and engage with the world, even though we're allowed to do that now still. So those are the things that we really want people to do. Help is available. There's a lot of help available. We just really need people to be able to identify for themselves that they need some support to work through that anxiety. Simple cognitive behavioral therapy techniques are so useful and so practical. Mindfulness, there's all kinds of things that you can do. Just make that a part of your regular day, your regular conversations.
Well, thank you all so very much. Another powerful service, I would say, for our community, and certainly our community caring enough to tune in, to listen, to ask those questions and feeling comfortable asking those questions. And we hope that tonight has been really helpful to you and to your family. Thank you for joining us, Anne-Marie and Dr. Mercer, Nicola. Well, you're both, if I say Dr. Zajdlik, I have to say Dr. Mercer. So I'm going to say Nicola and Anne-Marie and Helen. Thank you for your wisdom. And behind the scenes, we have Allison and we have Megan. And of course, Allison, imagine how she has pivoted, and I know a lot of people don't want to use that term, to say, okay, my boss, come to my house, we'll do it from my house. I think that's pretty cool. And that's great commitment. Great commitment, committed folks behind the scenes working to make this happen. Thank you all so very much. And a reminder that this is going to be posted on Facebook, and if you happen to be on Facebook or you're Googling Bracelet of Hope and you wanted to make a donation to Bracelet of Hope, feel free to do that. And the Facebook posting will happen within, I'm going to say, give us about 48 to 72 hours. And when I say us, Allison, Megan, and the CMHA team. And we will be back in September, September 14th. We're taking hiatus in August, and we look forward to you being very safe. We're asking you to please, if you only have had one vaccination, get the second. Please, we need you to get 2. And if you haven't had one yet, there's so many clinics now that are even just walk-in. It's not a lot of work. Some people don't like the administrative piece of searching and looking, and they're making it easy. There are signs out front saying, walk in, come by. And if you're not sure, just phone public health or ask a friend, or email one of us, or email Emery on her Facebook. We thank you so much.
Thank you, Marva.
Thank you, Marva.
Thank you.
Yes.
Thank you all so much. This was great. We look forward to seeing you again. So bye-bye. Have a safe July and August.
Happy summer.
Happy summer, everyone.
Bye, everyone.